Welcome back to another episode of the Nursing Now podcast. I'm your host, Janella McSwiggan, and I am here with Janella Woods. She is an entrepreneur that owns her own baking company, and she is also an occupational health nurse in the construction industry. And we're going to be talking about both of those topics today. Janella, thank you so much for coming on here today.
Thanks for having me, Janelle.
Can you tell my listeners a little bit about what an occupational health nurse does within the construction industry? Because I think this is new for a lot of listeners. So can you tell us a little bit more about that?
Sure. I started off things initially having the same idea when it came to occupational health nursing as the average person does. I've worked in healthcare for about 20 years. So all the occupational health nurses that I've ever saw were in clinics in the hospital. And my idea initially was, okay, occupational health nurses are nurses that will do your onboarding when you start working at a hospital. They may very well help with like your drug testing. They might give you immunizations like your flu shots when you start. And that's kind of like the role they have, aside from like if you have an incident, you'll go down to Occ Health, they'll help you out, and then that's that. In the construction industry, though, it's slightly different. Because you are dealing with a wide variety of potential injuries that occur. There's a big, huge mental health piece as well that goes along with occupational health nursing and construction. Construction is the second highest industry as far as suicides and mental health issues. So you deal with a lot of mental health in general. What I basically do on my site is I'm a medical catch-all. I help with any type of medical issues that occur on site that are within my scope of practice. Colorado is an independent practice state, so nurses can generally practice anything that's within their scope of practice, and it does not require physician prescription. We are allowed to do here. So I kind of independently do things that a nurse can do otherwise. Anything that you're trained to do in school or have specialty training to do that doesn't require a prescription, that's kind of what I take care of on my site. And then if things are a little bit more advanced or require an advanced provider, then I'll escalate to like an urgent care or to an emergency room for further follow-up.
Thank you. That's super thorough. I love that you mentioned that Colorado is an independent practice state, and I did not even know that that was a thing in any of the 50 states. It sounds like you have a lot of autonomy in your role. Are you the only healthcare worker on site?
Yes. I'm the only healthcare worker on site. There's an additional nurse that works. I was working 5 days a week, but I'm working 4 days a week currently now. And then there is a Monday nurse that works, and she also is pretty autonomous as well.
Wow. How many construction workers are on site when you're on site?
Like on my site currently, there are about 300 guys that are on site.
Wow.
And then there are also office staff, because there's an office building as well. So there's office staff as well, but we have about 300 trades that are currently on site. And it's a wide variety of trades ranging from like individuals that are doing concrete all the way up to like electricians, pipe fitters, welders, like you name it, we have it on site. The site that I'm on is it's a pharmaceutical site, so they're building a pharmaceutical building. So that's also very different than residential construction or doing construction on just a regular building. There's a lot of different specifications that are done when it comes to pharmaceutical construction.
I'm sure. So you must see like a wide range of injuries if you have all those different fields on one location. Like my dad's a welder, and he used to come home with some gnarly injuries. So I can just imagine like quite like the wide range of injuries on top of taking care of mental health issues. Do you have any like mental health programs to support the construction workers, or do you support them when they're having a tough time with their mental health? Like, how does that work exactly? Because you mentioned that their burnout rates were so high.
So we have a little bit of both. Being a wellness coach in the company that I work for, the nurses that are on site are mental health first aid certified for adults. So that is a certification that I carry, as well as the other nurse that I work with. And like through that training, you're kind of trained to deal with both crisis situations as well as non-crisis situations. I also spent time in my career as a psychiatric nurse. So I feel like that's also kind of lended a hand when it's come to, dealing with complex mental health issues and a wide variety of mental health issues. Um, and I do programming every month as well. So generally, we just a couple of months ago we had I think it was October was mental health awareness month, and I had somebody come in from one of the hospitals locally, and she spoke about mental health and mental health awareness during construction suicide awareness week and like prevention week. I did a speech during that week as well and kind of went over different signs. And I always tell people I have an open door policy that at any point in time, if they ever just need a minute, we all have life that goes on outside of our jobs. I always tell everybody at any point in time, if they ever need a minute to just step away from everything, they're always more than welcome to either pick up the phone and call me, or if they can't find me, or they can always come in my office. And even if they just want to sit and have like a moment of just peace and quiet where they're not having to necessarily be working and interacting with other people, that they are always more than welcome to come to my office.
Absolutely. Well, it sounds like they're really well taken care of by you, both physically and mentally. So, is this a common position? Do construction sites typically have occupational health nurses, or is this a unique role?
So it's a little bit of a unique role. I think in the future, it's going to be something that you see more and more often, considering the different regulations that they have within construction and the way that OSHA is set up. One of the big things with having an occupational health nurse is that safety element. It does help with the safety on site to have somebody physically that is there in person versus having to call 911 or delaying care by having to send somebody off. Having somebody physically there to do that firsthand assessment is so crucial and beneficial to the individuals that are here. There are some sites that, like, dependent upon like what their budget is, they will have a healthcare professional on site. You'll also see EMTs on site as well at times. They don't have the exact same scope as a nurse does. So it is beneficial to have a nurse, like I said, because we can independently practice, and a lot of the EMTs are not necessarily able to do that. But more and more, you're starting to see more medical people on sites, especially as the man count is higher on sites. You'll have more medical people that are directly on sites, or you'll have roving medics. And with roving medic services, a lot of times you can call an EMT to come in and check on people that are on site, but it's not necessarily the same as having your own personal nurse on site.
Thank you for explaining the difference between having an EMT on site and like a school nurse on site. I was wondering if an EMT was sufficient, so thank you for clarifying on that. I mean, it just makes sense to me. It just makes sense, especially for like OSHA guidelines. I
Mm-hmm.
know safety is like a top priority for them. I could definitely see this becoming more popular, and I'm always curious if they do have some sort of like a safety safety hub on these, like especially bigger construction sites, like you were
Mm-hmm.
saying, 300 workers. That's a lot. That's a really big work site. Um, so you helped set this you helped set this clinic up, but it wasn't your entrepreneurial idea. You work within a larger company. Is that right?
Correct. Yes.
So, can you talk a little bit more about setting it up? What were some of the steps of getting the clinic up and running, and what were some challenges that you guys might have faced that someone who might be running their own business for the first time?
The clinic that I set up was the best way to describe it would be an internal startup. The company that I worked for, they did a lot of health and well-being services. They had wellness coaches that they had on sites, and then they also during the pandemic they did a lot of clinic like like flu shot clinics and like COVID shot clinics, but
Yep,
having an
yep.
actual having an actual clinic that is like run between business hours and
Hmm.
is fully staffed was definitely different than having a pop-up clinic. So just kind of figuring out all of the operational pieces to that like was the first like step and figuring out what was needed. And then like just kind of going through from start to finish. Okay, this is what, this is what I want to do. This is what the goal is going to be. I think that was a big thing, is knowing where we were starting and what the goal was ultimately in the end, and kind
Hmm.
of being able to fill in things in the middle. And I mean, a lot of things were trial and error because it's not something that everybody does. So kind
Sure.
of figuring out like what supplies were necessary and like what, what was necessarily needed. That was a big thing, is like, okay, here are the kinds of injuries we're going to see. Here are the supplies that are needed for those injuries. And then like, you know, what like different parts of the project, kind of like what you're going to see injury wise more and what you're going to see less. Like you had like at one point in the project you would have more cuts, so obviously you need more dressings and dressing chain supplies, and then having the education to kind of go around that as well was big. So just supplies were so big. So anybody that does central supply can tell you how like just figuring out what supplies you need is probably one of the most difficult and pain points when it comes to setting up anything at all. So just figuring out the supplies, and then figuring out the order of kind of operations, like how you were going to do things, from like, okay, how are you opening, what your day-to-day is going to look like, because it was something that was so brand new. Like nobody really knew like what the day-to-day was supposed to look like, because they had wellness coaches, like just kind of embedding clinical into that. So figuring out what the day-to-day pieces were so incredibly important, and figuring out how to kind of make it flow, and then also work in a construction site, because it's different, having a clinic, running a clinic, and you don't necessarily have some of the challenges that you would have on a construction site. That was a big piece of it, is like figuring out how your day-to-day was going to flow within the day-to-day of other individuals that are working
Mm,
around you and that you're working
yeah.
around.
So interesting. Yeah, because all my businesses have been like remote, but I do know that some people are interested in starting like actual brick and mortar businesses. And it just seems like such a mountain of things to do. So it sounds like definitely predicting as much
Mm-hmm.
as you can about your business ahead of time. Maybe looking at other businesses and seeing what they're doing, predicting supplies if you can. And seeing if you can, I guess, predict like the overall flow of the clinic or
Mm-hmm.
whatever brick and mortar business you decide to do, um, might be the most important parts of starting.
And trial and error, like just
Yeah.
understanding that some things are just not going to work. Like it might seem
Yeah.
like a good idea, but sometimes you're just like, all right, let's start from scratch, because this didn't necessarily work the way I had intended for it to.
Yeah. Yeah. I feel like that's a part of any business. I have ideas all the time and they flop. Um, so what does your day-to-day look like for an occupational health nurse?
So I get to my site at about 6 o'clock in the morning. I kind of plan for my day at 6 in the morning. 7 o'clock in the morning I lead stretch and flex, and for those that don't know what stretch and flex is, first thing in the morning, that is when like all the contractors that are on the site that I'm on, we have a huge like break tent, and in the break tent we all do stretches first thing in the morning, and I lead the stretches. It's like OSHA has all kinds of studies that they've done, and so do a lot of the general contractors regarding injuries, musculoskeletal injuries, especially while on construction sites. It's a very common injury. So they encourage everybody that's on construction sites to do stretches first thing in the morning. So I
Nice.
lead stretch and flex for about 5 minutes in the morning. It's not anything like crazy or ridiculous, and it's people stretching to their comfort level. But I go from head to toe, make sure everything is stretched out. And then after that, there's pre-task planning that goes on from the general contractor and the contractors that are on site. We also go through like kind of what the day is supposed to look like as a group. So you have a group of 300 guys and the superintendents and the general contractors, and we're all looking at a projector and we're going over, okay, here are your walk paths, because there's so many hazards in construction as well. So you have to really know like what's going on, and you have to have that 360 awareness. So going over all of that first thing in the morning. And then after that, I'll sometimes attend some of the pre-task planning boards for the different contractors. I do safety announcements during some of those at times. Then I go back to, I have a medical trailer that I have set up. I go back to the medical trailer, and that's where orientation occurs. So anybody new that's coming in, that's where I kind of have my introductions. I kind of let them know who I am, what I'm doing on site, because a lot of them have also never had an on-site occupational health nurse.
Mm-hmm.
So just kind of introducing myself and letting them know, like, I'm here to be supportive. I'm here as a resource. It's a nice first introduction for them as well, because some construction workers have not necessarily had the best interactions with healthcare professionals. So kind of having that, one-on-one introduction with them, and not just an accident occurring, it's a lot more personalized than, one day something happens and you see me out of nowhere and you don't know who I am. So at that point, everybody kind of gets to know who I am. And then after that, that's when like the day really kind of begins, because that's when the medical part of the day begins, is after orientation. Then at times, like I'll go for a site walk just to kind of check on everybody. A lot of times, injuries will occur within the first hour of everybody being at work. So just kind of walking around first thing in the morning, checking in on everybody. It also serves as a reminder at times, like when people aren't really thinking like, hey, am I going off and like paying attention to my surroundings the way I should be paying attention to my surroundings? To see somebody medical there, it sometimes will turn on a light bulb in people's heads, like, hey, I need to make sure that I'm taking care of myself and I'm being safe. But like I walk around, and then I have site walks throughout the day. Sometimes I'll go in and visit with people during lunch. So a lot of like the interactions I have are either people coming to me because they've had injuries, or like they'll see me just out on site, and I'll kind of check in with people and ask how they're doing like for the day, and like check in on everybody's mental health just by, asking a few simple questions to see where they're at.
Wow, I love how evidence-based so much of what you said was, from the stretching to the walk around to help remind people to not get injured within the first hour, because I would definitely get injured half asleep. Yeah, that was awesome. Thank you so much for explaining that. That I definitely didn't know that so much of that went into occupational health nursing for a construction site. I want to pivot just a little bit because you also have a baking company, which I
Yes.
think is awesome. I love people that have passion projects and they nurture them, and some people decide to keep them as passion projects, and other people decide to monetize them. So, can we talk a little bit about your baking company?
Absolutely. I have a baking company that's home based. I'm registered with the state of Colorado, though, as a business. I'm a small business owner. My company is called Data Cakes. My husband's a data scientist, and I like to bake, so that's where Data Cakes came from. Um, I have been baking for, it's 2024, since 2019, so it's been a while now. I had done like baking just for my family prior to that, but I started professionally baking in about 2019. I do everything gluten-free. I am gluten-free myself, not by choice. I love biscuits, so it would be nice if I could eat regular biscuits, but I eat gluten-free biscuits now. I have not been gluten-free my entire life. I have autoimmune issues, and this kind of stemmed from like just my body just being like, nope. And it decided that it was not going to properly digest gluten anymore.
Yeah.
So I have been gluten-free since about 2016. And I used to get very frustrated because everybody could eat cake and I couldn't. And then a lot of the gluten-free cakes at the time were pretty nasty. So that's what kind of encouraged me to decide to start baking myself. It started then, and it has just kind of gone from there. I do birthdays, weddings, I do all kinds of things ranging from like cake to cookies to just a wide variety of desserts. Um, and I have really enjoyed that. Like, I think I really kind of got into baking, especially like during the pandemic. Like, I liked baking anyway, and my business started a year before the pandemic, but I think I kind of honed things during the pandemic as an outlet. It was nursing stressful. Like, you have to have
Yeah.
something outside of just being a nurse. At one point, I like ate, slept, lived, and drank nursing, and that is all I did. And I feel like I fully lost my identity, just being a nurse. Like, that's all I
Mhm.
was a nurse.
Yeah.
I was either just a nurse or a nurse and a parent, but there was so much that revolved around nursing
Hmm.
that I got to the point that I did not have an identity outside of nursing. And it became depressing, like
Yeah.
that, like this was it. And then when the pandemic happened, it was like, oh my God, this is it. So like having
Yeah.
something outside of nursing, I feel like it helps so much, like mental health wise. Um, for myself, and then I've also seen other nurses that have, pursued passions outside of nursing, and it has helped drastically when it's come to their mental health as well.
That's so interesting because I've talked before about how strong the nursing identity is. I've mentioned how we're the only profession that I see like bumper stickers of and cups of and t-shirts of. Like my husband's a mechanical engineer. Never once have I ever seen a bumper sticker that says mechanical engineer. So it's such a strong identity to us. But at a certain point, it does start to become so over encompassing.
Mm-hmm.
And it's easy to let it do because we're so proud of helping people and we're so proud of what we do. And there is so much to be proud of. It is a really beautiful job to have. But if you go down that path too deep, I can definitely see how it can be a sad, sad place. I've always been blessed with way too many hobbies all of the time. So I've never dealt with just the nurse identity. I've always been the skier, the crocheter, the writer, and everything else. But it sounds like you were able to turn this into a really
Mm-hmm.
constructive thing, especially your gluten journey too. Um, so that's really cool that that's how this all came about. Thank you for sharing that. I had no idea that it all started with a gluten intolerance. And I have seen some of the gluten-free products, and I would definitely start my own baking company too. Um, so was it hard to get your own like baking company started? Was that complicated?
It start like a lot of it started with like friends, like people that
Yeah.
like I baked stuff for people at work all the time. Like anytime there was like a like let's say we were having a potluck, I would be like, oh, okay, well, I'll bake something because I wanted to get to the point that I practiced and kind of like honed my skill. And then it got to the point that like people were like, hey, such and such is having a going away party. Can you bake the cake? And these are people that were not gluten free, that were like, hey, we like your cakes better than the regular cakes we get from like different grocery stores and stuff like that.
Yeah.
Um, so I was like, sure, I'll go ahead and bake the cake. And part of baking also was I got tired of like going to events and stuff like that and not being able to ever eat the cake.
Yeah.
Um, because I love cake. So it was really hard, like going to people's wedding and not being able to eat the cake. So the first wedding I ever baked for was a coworker's wedding, and I ended up making her a 3-tier cake. Plus, I did a cupcake bar that had, I think it was like 7 different flavors of cupcake, and they were all gluten free
Oh,
because
wow.
I was like, I want the opportunity to eat cake. And I knew the groom's aunt was she had celiac. So I was like, you know what? I'll make your cake and I'll do your cupcakes. They had gone to local bakeries and done like cake tastings, and they weren't necessarily satisfied with some of the bakeries that they had gone to. And I do a variety of flavors too. So that's a big selling point as well, as I do
Yeah.
non-traditional flavors. So they decided they wanted to utilize my services because they were like, hey, we have this aunt that is never able to eat cake at weddings or anything like that either. So I was like, sure, I'll go ahead and make your wedding cake. And then I was like, oh my God, what have I got myself into? Because I'd never made a wedding cake before.
Yeah, that's a tall order. The panic
So
sets in after.
yeah, it turned out really well. It was
Yeah.
absolutely beautiful. Everybody was
Oh,
just completely shocked at how well it did turn out. Um, I did watch some YouTube videos
of
because I was like, I have
course.
no idea what I'm doing.
Yeah. That's
But
what
it was
YouTube is
like,
for.
oh yeah, for sure. I love YouTube. Like YouTube
Yeah.
has like helped out quite a bit in all of my crafting endeavors.
Yeah.
But yeah, it definitely worked out well. And then after that one wedding, I was like, you know what, I could do this more regularly. So I advertised quite a bit on Facebook. I set up a Facebook page. So I do have a Facebook page. So I set up the Facebook page, and then slowly but surely, like different people that had like craft fairs or things along those lines, or people that were specifically looking for gluten-free bakers, started reaching out to me. So I've done a lot of weddings all over the Denver area. I've done some weddings also in northern Colorado. And that's kind of where things took off from. And like I said, I also do birthdays and like birthday cakes as well. So I've done like a wide variety of like just different events too for different companies as well.
Yeah, that's so cool. I always think of the limitations of only being able to sell to your geographical area as
Mm-hmm.
someone that owns their own like digital digital product that I sell, but to in your case it actually works out in your advantage because it sounds like there's not a lot of people offering the service that you have, and it's not like they can order a cake from New Hampshire and send it to Colorado. So
Mm-hmm.
if you're able to sell that service in a certain area, especially like with baking with something that goes bad within like a few days, it's actually a really good selling point. So that's super interesting and something that I've never actually thought about before. That's cool. And I love that it was kind of like a stubborn, like out of spite, like I don't get to eat, so I'm gonna
Mm-hmm.
make something really good.
I'm gonna
Um,
have cake.
yeah, yeah. One of my really good friends is vegan and she's been like that for a really long time. From a another health condition, and she has become one of the best cooks ever. And her mac and cheese is so good because that's one of the meals that she really, really missed making. And it's a meal I make all the time, and you literally can't tell that there's no cheese in it. It's like wild. And the sauce is made from like carrots and potatoes, and
Mm.
it looks like the color of mac and cheese too. Um, it's really, really good. So if anyone wants
I'll
that
have to
recipe,
get that recipe
yep,
from you.
yep, let me know. It's really, really good. Awesome. And I love that you mentioned that you advertise on Facebook because
Mhm.
I had a feeling that it started with word of mouth and then went from there. But I also always wonder how someone that doesn't own like a storefront
Mhm.
sells their product. Because I could totally imagine me walking down in like Denver and like seeing cupcakes and being like, I need those cupcakes. But Facebook is such a good market for so many people. And I
Mhm.
keep hearing that time and time again, like Facebook, especially like Facebook groups,
Mhm.
or like town Facebook pages. I know some people sell baked goods on my town Facebook
Yeah.
page, and that's really popular. We're a sourdough town. Sourdough is very big
Nice.
there.
Nice.
Yep. So that's my neck of the woods.
You would
Awesome.
be amazed though. I've had people that have contacted me, like they'll have family members that, are flying into Colorado from somewhere else and they'll contact me and they're like, "Hey, can you make me a cake?" And like I've made cakes and like had them delivered to people's Airbnbs when they've come from out of town. I've had so many people out of state that they're like, "Hey, my son goes to college out there. Is there any way that you can make a cake for him? It's his birthday and I'm sad he's not going to be home for his birthday." So I've done stuff for people that are in state. Like I've had people contact me from out of state to like deliver cakes places as well.
That's so wild. And that's cool too that you're celebrating these moments with these people in a way and you're like a part of that that like celebration. So that's like a really lighthearted business. I love that.
Mm-hmm.
I love that. That's really fun. And you're currently going for your MBA. Do you have any long-term plans with your MBA, or does it just make sense? You're such like an entrepreneur that you're like, I will find a way to utilize this eventually.
So my MBA journey started because I feel like there is a bit of a disconnect at times between those of us that work on the floor and the business side of things in healthcare. And I feel like more nurses need like business, it's like speaking a whole nother language. So I think like having more nurses that can speak both languages, it's like when you have a person in healthcare that is bilingual that can help an entire group of patients that doesn't speak English.
Mm,
Sometimes like that bridge is needed and there needs to be more of us that are able to like cross that bridge when it comes to like direct patient care and the business side of nursing. So ultimately goal wise, my goal is to be able to help advocate for the nurses that are working in direct patient care and just anybody that's working in direct patient care as well as the patients, because I feel like nursing needs more of a voice. And I love the fact that there's so many nurses nowadays that are becoming more involved when it comes to legislature
yeah.
and just like everything in general. I feel like it's such a big deal. And I think that like that's what the future is for nursing. I've been in healthcare, like I said, for 20 years. So I've seen so many different changes that have occurred within healthcare. So kind of being able to advocate and also be that voice because the younger generation of nurses needs more nurses that are experienced. A lot of us, I feel like, left, after and during the pandemic. So
Mm,
having the nurses that have stuck around, that are willing to go and, be that voice for some of the less experienced nurses or some of the nurses that just aren't confident enough to speak up about some of the issues that we have in healthcare. Like my big thing is advocacy more than
yeah.
anything at this point, and being able to like sit at the table with the business people.
That was a great point. I couldn't agree more with you. I'm a huge advocate of advocacy. One of the reasons I love this podcast is I've had more and more nurses that I don't know reach out to me on LinkedIn with their stories of work of working at the bedside, or just telling me that they really resonated with the podcast and what we're saying on here. So I think that my path towards advocacy is getting like more and more prominent. I also plan on having a nurse that is focused on nursing-based legislature on. So that's
Nice.
another exciting thing. Yeah, she asked to come on, and I was like, yes, please. I have a lot of questions for you, and I'm very excited. So that's awesome that you're also going down that route. I think we need more and more nurses that are that can speak both languages, like you said.
Mm-hmm.
Um, so do you have any like parting words or best advice for nurses out there that either want to start their own business, whether it be a baking company, or might want to transition into a role that is like non-traditional, like an occupational health nurse in a construction industry, anything like that?
One of them is you can be anything you want to be as a nurse. Like
Mhm.
that's the thing is like we can wear so many different hats and like you're always needed. I feel like
Mhm.
we just get lost in translation at times. So like understanding like how important your role is as a nurse for the patients and for other nurses. I think is just it's absolutely incredible. Like we have the ability to touch so many people, and if you stop and think about it, people don't forget nurses, the good, the bad, the ugly, they don't forget us. We
True.
change lives, and like what we do is so incredibly important. And I think the other thing is like just keep moving forward. Like we're all gonna have setbacks here and there. Everybody has like you can I've spoken to so many different nurses at this point that like one of the biggest mentors I have is one of the CNOs at one of the local hospitals, and she like always is so encouraging, and I think it's important to like make sure that we stick together and we are always encouraging one another even
Mhm.
on like the small things that we decide to do.
That's
um
okay. Love it. Keep up, keep going.
but just like taking the time to like nurture one another. When I started nursing, there was a whole lot of the nursing that eat their young, and I was
Yeah.
eaten and regurgitated several times.
Oh,
um just making sure that like we take care of each other, because at the end of the day, like we take care of the world. Like if you stop and think about it, we take care of the entire world. So if we do not take care of each other, there's nobody to take care of the world. So just it's important that we make sure that we take care of one another and have healthy outlets. Having time for self care is important. Taking care of yourself. I think that's something that we lose and we forget as well. So, taking the time at least even once a week to say, okay, this is what I'm doing for myself. It's
Yeah.
incredibly important so you don't get lost in translation and you don't lose yourself within healthcare and nursing. I think that's kind of it in a nutshell.
Amen. Amen. When I meet a nurse right away, I'm typically like, I'm the opposite of an eat your young type of nurse. I want to help you. I want to
So do
see
I.
you need. There are so many things that are stacked up against nurses, whether it's our 12-hour shifts that are like of our nightmares, or, just the world not quite understanding what we're going
Mm-hmm.
through, that the least I can do is support another nurse and let them know that they have an ally in me. And I'm just
Correct.
so committed to that message. And I'm seeing more and more nurses around me making themselves available. I don't know if it's kind of like you put your vibe out and your tribe kind of like comes around you. So I don't know if it's the energy that I'm putting out or if it's truly people getting so sick of the eat your young mentality that they're just trying to push back on it because it serves no one. No one wants
Yeah.
to be bullied, especially in an industry that already has a shortage in some areas.
Mm-hmm.
Like we're not helping anything here.
No.
I love that you said taking care of yourself in an outlet that's not nursing. I'm a huge proponent of hobbies. After this call, I'm heading to the gym. um, so I think it's important whether it's active or if it's just hanging out and taking a bath. I'm also a huge
Mm-hmm.
proponent of being in warm water, like
Yeah.
whatever it is that you need to do to nurture your soul and feel better. Um, I definitely agree with taking care of yourself too. And that's going to be different for every person. Um,
I think every nurse should soak in a bath of like bath salts and eucalyptus once a week. Like
yes.
eucalyptus just it relaxes your entire body. And I think like just even doing something like that once a week or having like the little steam tabs that you put in the shower and taking
Hmm.
a longer shower and just breathing in all of the like nice warm eucalyptus is great.
Yeah, taking a second just to decompress.
Mm-hmm.
Yeah. Sometimes I don't notice how like clenched up I am until
Mm-hmm.
I like let go and I'm like, ooh, like I need a second. I need a couple of deep breaths in the shower to just kind of like declench my entire body. All right. All right. Janella Woods, thank you so much for coming on here. I can tell that
Thanks
you're
for
going to make,
having me.
yeah, absolutely. Anytime. I can tell that you're going to make such a big difference in the nursing world. And through your baking, through your occupational health, and through your MBA, you're a nurse that makes our industry proud to have. So thank you so much for everything that you're doing out there.
Thanks for having your podcast. It's nice to have like a voice behind nursing and to see people that are wanting to bring everybody more together.
Absolutely. All right, guys. I'll see you on the next episode.